Now, a big national story breaking this afternoon. The Liberal government and New Democrats have reached a deal that will give Canadians access to free diabetes medication and birth control. It will also lay the framework for an expanded national pharmacare program in the future. Emily Taylor joining us live in studio now with the details. Emily.
Hi, Matt. It's a big win for the NDP, who have been pushing for quite some time to get this national pharmacare program as well as a national dental care program. It's in exchange for their support for the federal minority government. Actually, the leader of the NDP, Jagmeet Singh, threatened to pull his party's support if the feds didn't meet his March 1st deadline to make this deal. The program includes insulin for type 1 and type 2 diabetes, as well as additional diabetes drugs and funds for supplies such as glucose monitoring devices. The government is also expected to fully cover contraceptives. That includes IUDs and emergency contraception or morning after pills. Ontario does currently provide access to some birth control for people under 25 without private insurance. The NDP says a national pharmacare program will save Canadians $500 a year on average, and the public health care system nearly $1,500 per patient each year. Conservative leader Pierre Poilievre called out NDP's leader this afternoon, saying his support of Trudeau's Liberals is driving up the cost of living for Canadians. I spoke with a political scientist this afternoon who says the program will really make an impact for all Canadians if it starts to cover all drugs.
This is being rolled out in little bits and pieces. And it may be that at a certain point it prevents you from getting from the full-blown program, a universal program that the NDP has championed and which a number of Liberals have championed too over time, in that you cover a bunch of drugs, but you don't actually get to covering the catastrophic drugs, which is probably the place you should be starting, and the range of drugs that allow you to push down the prices that the drug companies can charge. So, symbolically, it indicates a capacity to act on this file. But if it's just followed up by adding a few drugs here and there, you probably don't get to a program that makes a kind of tangible difference, if families faced with having to, pay for a catastrophic drug coverage.
Legislation is expected to be introduced in the House of Commons next week to really finalize this deal, though we don't have a timeline yet for when Canadians will be able to access it. Now, if the federal government does move forward with an entirely universal national pharmacare program, it's expected to cost $40 billion a year. Matt?